News outlets across the country have been featuring coronavirus-related headlines since the pandemic began over a year ago. These are just some of today's headlines. Some highlight how the U.S. is slow to track COVID-19 variants. Others focus on the difficulties of reopening schools or getting vaccines for undocumented migrants. One researcher suggests there's one common thread among all news outlets: negativity. A new working study examined hundreds of news outlets, both domestic and international. The study found 87% of COVID-19 coverage in the U.S. was negative, compared to 51% of international coverage. It also outlines how U.S. media fails to showcase positive COVID-19 developments despite changing trends in some areas of the country. Joining me now for more is the author of this report, Bruce Sacerdote. Bruce is an economics professor at Dartmouth College. Bruce, welcome. It's great to have you with us. You know, these observations are so spot on. When I was reading about your research and your studies, I thought this is also true. Let's get to the bottom of it. Why do you think media outlets in the U.S. are focusing on negative stories, particularly when it comes to COVID-19, and why do we not see this trend internationally?
Well, I'll tell you, our fear is that it's because it's what sells. You know, this tends to be the kind of thing that grabs views and attention. And so people, you know, it's about viewer engagement. And in the era of 24-hour news, this kind of negativity grabs people's attention and holds it. And it's, you know, it's just a slightly different business model in Europe versus here.
It's interesting, though. I did read a New York Times article about your research, and the author of that article had a slightly different take, saying, you know, as a journalist, I don't often consider who is consuming my work, but I do feel the need to quote unquote uncover things, right? So there's this idea that if you're only being hard hitting if you're getting to the bottom of things and uncovering the sort of negativity, right? So maybe that's a cultural bias when it comes to newsrooms.
Yeah, I think that's a completely fair thing, and I want to give great credit to David Leonhardt, who wrote that article, because he made our results well known and got us some I think very useful attention for it. But, you know, investigative journalism, that's a super important role for the American media. I think that's probably only one key role for it to play. I mean, I think that, a fair and free press is really essential to the work of a democracy. But there is also just the reporting of the facts, you know, like if there's good news about vaccines and about school reopenings, it's also important to just put that out there, even though it may not be sort of deep, and it may not require deep investigative journalism.
Right. So, you know, does this type of reporting then affect the way the public understands developments in the fight against COVID-19? You know, are we doing the public a disservice when we report it this way?
You know, I think quite possibly. I mean, levels of depression are way up in this country, and obviously that's hardly attributable entirely to the media, right? But the more that we emphasize the bad stuff and kind of don't push the hope of the fact that the vaccine development and rollout has gone tremendously well. If we're not pushing that, then people are going to tend to lose hope. Then they may tend to not reopen schools fast enough, or reopen, say, baseball and outdoor sports and things, because they believe the danger is different and the problems are different than what the problems actually are.
You know, the data was largely gathered when former President Trump still held office. And, you know, we now know that there were lots of irregularities with the way his administration reported COVID-19 data. So do you believe that his presence or his administration influenced the coverage of COVID-19? And has that changed since President Biden took office?
So I would say that's a great question. I would say without a doubt, there's a Trump effect here. I mean, Trump was such an interesting character and really interesting to cover and to talk about. But at the same time, and clearly, you know, we looked at the number of articles written about vaccines and vaccine researchers versus things that I would put as almost silly, like Trump and hydroxychloroquine. And there's actually more Trump hydroxychloroquine articles than there are articles about vaccine researchers. That said, you know, this negative trend has continued, even though there's been sort of a bit of a downward trend in negativity, the gap between U.S. and international sources remains really strong. So it's not just a Trump effect. And I think this fascination with the negative predates Trump, and I think it will continue after Trump.
Well, comparing the way the U.S. reported on COVID-19 to the international press, did the political leanings that we've seen play out here play out internationally as well? Because we know there's been a little bit of a difference in the way COVID-19 has been reported depending on the slight political leanings of the network or the media institution.
Yeah, I mean, it's clear, different networks. And what's interesting, what's almost good about this is that the networks are not shy about admitting what their strategy is and that they're catering to a different audience, right? There's not a secret. It's explicit. And it kind of interacts with the negativity, but you see less dispersion across outlets in Europe, and in particular in the U.S. The thing is that both kind of right-leaning and left-leaning media are negative in covering COVID and in covering school reopenings and even in covering vaccines. It's just a different kind of negativity. So Fox will talk up how badly things are going in Michigan, and isn't it terrible if these blue state governors don't know what they're doing? And CNN will talk up the fact that there's certain states where the governors have lifted restrictions too early. So they're both negative. They're just negative about slightly different things.
So what can media outlets, what can we be doing better to try and reverse this trend, or at least be more aware of it?
I think the most important thing to do, clearly people need to know the facts, right? So, for example, if it turns out that once you're vaccinated, you can go see your grandkids, or that if you've had COVID, it's extremely unlikely you're going to get it again, or give it to someone else. I think those are really important facts to get out there. I think one thing that would be super helpful for any media outlet to do is to put things in context. So, for example, somebody dies after getting the vaccine or gets a terrible, almost fatal case of COVID after getting the vaccine. Put that in context and note that that's 1 in 100 million. Or the number of blood clots that were experienced after getting the AstraZeneca vaccine. Let's put that in context and talk about, okay, that's a few cases out of the millions upon millions upon millions of doses that were delivered. So I think that context could be useful to people and help them scale risks.
All right. Well, Professor Bruce Sacerdote of Dartmouth College, thank you so much for joining us. We really appreciate your insights, and we'll try to take them to heart.
Thanks for having me on. It was a real pleasure.